Bioengineering has been the forefront of controversy in recent years due to its implications for gene editing. Although bioengineering has its negative connotations, it also has its positives. Currently, scientists and researchers are using a type of bioengineering called CRISPR to improve the treatments and cures for sickle cell anemia. According to the Institute of Health Metrics and Evaluation, 1.92 billion people worldwide suffer from normal anemia. That accounts for 25% of the global population. By using bioengineering and CRISPR to improve the treatments and cures for sickle cell anemia, we're also going to improve the treatments and cures for normal anemia. I'm a regular blood donor, so I've had to research this topic and I also find it interesting. And in addition to this, I've taken a college-level biology course where I have used and learned about CRISPR, and I've also learned about genetic diseases like sickle cell specifically. First, I will talk to you about sickle cell, and then I will discuss CRISPR and its uses, and finally I will conclude by talking about how research groups are using CRISPR to improve sickle cell treatments and cures. To begin with, according to Mayo Clinic, sickle cell is a blood disorder. It causes the hemoglobin in red blood cells to become distorted. A normal red blood cell is malleable, round, and can easily flow throughout the body. However, the malfunction that causes sickle cell distorts the red blood cell into a crescent moon shape. Hemoglobin is one of the ways that blood transports oxygen throughout the body. So when it is distorted, the body, including the organs, muscles, tissues, and bones, begin to be deprived of this critical oxygen. In addition to that, sickle cell gets the anemia part because cells die at a quicker rate, which causes the body to receive less oxygen, which is identical to regular anemia. Referencing Johns Hopkins Medical Center, this disease can lead to acute chest syndrome, which is defined as having chest pain, cough, fever, and it can also lead to having a stroke and jaundice, which is the yellowing of the skin. In this photo right here, you can see what a normal red blood cell looks like. It's round and it has that healthy hemoglobin. And then in this picture, we can see what a sickle cell looks like. We can see that crescent moon shape and that abnormal hemoglobin. When a normal red blood cell flows through a blood vessel, it can flow easily and undefined. It can just go where it needs to go. But a sickle cell can cause blockage, which can cause the stroke that I was talking about earlier. After reviewing what sickle cell is, I can now discuss what CRISPR is. It is a biotechnic and it has a lot of utilizations. CRISPR, which again stands for clustered regularly interspaced short palindromic repeats, is a gene editing tool in which researchers can easily alter genes in living cells. Referencing the Kansas Corn Stem Association, CRISPR can determine a gene's purpose and turn it on and off. It can also correct mutations and introduce a desired trait. By turning off a gene, like I said that it can do, it can remove the trait from the lineage, therefore removing the mutation completely. CRISPR is naturally occurring in bacteria and has the potential to revolutionize modern medicine as it can detect diseases and infections, cure said diseases and infections, and alter poor genetics, which can cause pain and overall poor quality of life in organisms. CRISPR is being used to treat sickle cell by either blood stem cell therapy or gene therapy. In reference to data from the University of Columbia Irving Medical Center, Casgevy, a type of CRISPR, was approved by the FDA in December of 2023 to be used as a treatment for sickle cell in patients 12 and older. With Casgevy, doctors could edit certain genes to reduce the pain that is caused by sickle cell anemia. With our knowledge on sickle cell anemia and the gene editing tool CRISPR, we can finally discuss how research groups are using CRISPR to heighten sickle cell anemia treatments. According to the University of California in San Francisco, their hospital received $17 million to create and start a clinical trial that includes using CRISPR to correct the sickle cell disease. The first step of this is being led by multiple University of California schools, and they will test 6 adults, and once those tests have proven safe and effective, they will expand to teenagers. There are 2 treatment types that scientists are exploring, and those are blood stem cell therapy or gene therapy. According to Sanders, project teams from University of California in Los Angeles and San Francisco and the New Innovative Genomics Institute have developed a treatment in which patients' blood stem cells have been modified by a CRISPR nucleus to stimulate the repair of the sickle mutation. Current trials include patients' blood cells being extracted and being sent to a UCLA gene lab. From there, cells will be processed by using electrical pulses, creating temporary pores in the cell membrane. From there, CRISPR platforms will flow into the cell and travel to the nucleus, where they will correct the sickle mutation before the blood is reintroduced to the patient. In this trial, patients would be their own stem cell donors, which is safer than alternative options, comments Dr. Mark Walters, professor of pediatrics at the University of San Francisco in California. Additionally, Felser says that in accompaniment with the FDA's new approval of gene therapy, the Boston Children's Hospital will start a gene therapy program. In this program, doctors will use Casgevy, the type of CRISPR that I referenced earlier, to restart the production of fetal hemoglobin, which would reduce BCL11A. BCL11A activates beta hemoglobin, which is a mutated gene in sickle cell anemia. Fetal hemoglobin is present at birth, and it is more effective than adult hemoglobin. So by repressing the beta hemoglobin and starting the production of fetal hemoglobin, we can reduce sickle cell anemia and provide better oxygen to those patients who have the disease. Conclusively, I gave you a background on sickle cell anemia, then discussed CRISPR and its uses, and I finally talked about the research groups that are finding ways to cure sickle cell anemia through CRISPR. Sickle cell is a disease that misshapens the red blood cells and causes a deprivation of oxygen. CRISPR is a biotechnic tool that can be used to add, delete, or alter genes in a living organism. To treat sickle cell, universities in California and the Boston Children's Medical Center have been conducting blood stem cell therapy and gene therapy. People living with sickle cell experience something called a crisis. This is caused by the blood vessels being blocked by the mutated cell. This causes an extreme sense of chest pain and overall lowers the quality of life. These crises are often referred to as an episode of extreme pain or a pain crisis. By using a bioengineering tool such as CRISPR, we can alleviate that symptom or the crisis overall and perhaps cure sickle cell for once and for all. Although CRISPR can be frightening due to its implications for gene editing, it does have its positives.